So we're just basically gonna go over the PowerPoint, and then we're gonna go over the typical questions that you would get when you're recruiting for this project. And then I'm gonna do an example on the red cap, just in case any questions come up. Let's leave the questions towards the end of the PowerPoint or towards the end of the red cap. So the agenda today is recruitment and consent and data entry and red cap. For the recruitment part, we will be using a convenience sample technique to approach all eligible adult patients who present to the ED during the 8-hour one-day blocks, which is typically around 9 a.m. to 5. So the inclusions, so when you look at your tracker, basically anybody that's an adult patient in the ED, and then this part with the past medical history of a COVID test, that you won't find out until you actually talk to the patient and you're screening them in person. So you won't see this in the chart. And I don't know for other sites how it works, but for our site, we're not able to see that in the chart. Plus, you don't know how many times the person actually had COVID, or maybe the COVID test is not there, but they actually have had COVID. So for this part, it's not until you talk to the patient. The chief complaint, you can see the chief complaint in the tracker. And for the chief complaints, it would be anybody, but not limited. So that means that there are other symptoms that maybe are not listed here that can be related to COVID. So like fatigue, tiredness, malaise, cough, chest pain, shortness of breath, fever, difficulty concentrating or thinking, and the rest. So basically just all of these. And also there might be other ones that if they come up, please email us about it and ask us, or you can also, like, I don't know, guess. But it's just anything related to COVID. Anything that would exclude a person from participating in this project would be like if they're not 18, if they're presenting to the ED intoxicated or overdosing, if they have an altered mental status, obviously they can't consent. If they're super sick, that would be another reason. Another thing would be like for the altered mental status would be like dementia. You know, patients with dementia cannot consent to participating if they're incarcerated or they have a psychiatric hold. And this will be like a 5150, or if they're suicidal, anything that has to do with psychiatric. And then if they're in isolation, obviously you wouldn't be able to go inside. If they currently have COVID, that would be another exclusion criteria. And then these would be the complaints that if you see it in the chart as a chief complaint, you wouldn't approach them. So like if they have trauma, major or minor, like lacerations, sprains, fractures, skin infections, eye problem, obviously they're not related to COVID, but they're not typically related to COVID. Cellulitis, and the list goes on. Then to consent the patient, it's just going to be a verbal consent. So no signature or anything needs to be collected from the patient. And then the data entry. So the data entry, as all you know, as everybody knows already, it's going to be hosted by UCSF. And I think the majority of the CRCs or RAs have been added to RedCap. If you still don't see your name added, please feel free to email me. I know I'm working with one other CRC that their name for some reason looks like they already created a RedCap, but they haven't. So I have to submit a ticket to IT for that. So if you're having any problems with RedCap or accessing it, please email me. And then patient identifiers like medical record numbers and phone numbers, we are not going to keep a record of that. The only reason you're going to need that is if you're going to write it down somewhere to go recruit a patient, but that's not going to be recorded in RedCap. And then the surveys, and the screening log could be either by paper or put directly onto RedCap. However, if you are doing paper surveys or paper screening log, please enter it after to the RedCap so that we can have access to do the quality assurance reports. And that's pretty much it. Do you guys have any questions?
I have a question. If I see that someone's reason for being in the emergency department is a fever, and I start enrolling them, and then I realize that their fever is because they have an abscess, would I keep going?
So like maybe in the chart, they might talk about like in the physical exam, it might say like, well, actually, no, because we wouldn't know if it's because of the abscess or they had a fever
Caused by
before.
something else. Yeah. I mean,
Yeah.
it's most likely because they're septic from, but I just,
Yeah, I agree with you. Like it's more than likely that it's the abscess, but I think that you would still include them unless it says like fever due to abscess or
right.
the chief complaint also has an abscess as one of the differentials.
And
Then-
if they come in with multiple complaints sort of thing, I feel like that would be somebody we would include.
Yeah, I think so.
Okay.
Mhm.
Okay.
Any more questions regarding this? Okay, so I'm gonna go to this part now. Okay, so I uploaded this Word document to the box, and also feel free to email me if you don't have access to the box, because I think that's very important for you to have these documents with you. So these are just typical questions when you're screening a patient, and this is more regarding to like when they had COVID. So I know that for our sites, we had a lot of questions when we started the project, whether they qualified or not to be in the survey because they had COVID recently, and then like a month ago they had COVID, and then they had COVID 2 years before. And so these questions here answer almost all scenarios that you could come when you're recruiting. And you can read this later, and if you have any questions regarding any of these questions and answer, you can email me. But they're pretty easy to read. Okay. And then the last thing that I'm gonna do is I'm gonna do an example. So this is how the RedCap's gonna look. The screening part is here. So you're gonna write your CRC initials, your site, and then you're gonna ask the patient if they've had a positive COVID test. And if they say yes, obviously you're gonna ask them if they want to participate in the study. If they say yes, you're gonna put in their ID number. If they say no, you're gonna write down their demographics. If you can visually see it, you don't ask the patient these questions. You can just, it's just a visual screening. Does that make sense? And then let's say that I'm gonna go through. Let's say that they say no, then again, it's just a visual screening. If they say possibly, you're not gonna enroll the patient, it's just gonna be a screening. And if they say, I don't remember, same. If they say yes, but the confirmed infection was less than a month ago. So this means that the patient said, oh yeah, last week I had COVID, or 2 weeks ago, 3 weeks ago. And they've never had COVID before that either. Does that make sense? So you wouldn't enroll them. It has to be greater than a month. And this goes, okay, so let me go back to the.
So see, how are we doing our study numbers for this one?
Oh, it's gonna be, wait. Is it SC? Miria? I forget.
So it's your site name and then L. So like if it's Duke, it's DL, Washington, your UWL, because we do
Got it.
have Wayne State. So
Got
Wayne
it.
State is WL.
Okay.
Baylor is BL, Jefferson is JL, and so on.
So let's, I'm gonna go back to these questions. So for example, should a participant be enrolled if their first COVID infection was detected less than a month ago? So no, obviously, because here we have that their infection was not more than a month ago. Should a participant be enrolled if they had more than one COVID infection confirmed? Yes, but the question should be directed to the infection that was more than a month ago. Does that make sense? So if they say like, yeah, I still have a fever from my last infection this past month, that wouldn't be like that wouldn't be something that we write on the survey. All the questions in the survey should be focused on the infection they had the first time, which was more than a month ago. Should a participant be enrolled if they had more than one confirmed COVID infections and their most recent infection was less than a month ago? Again, it's the same thing. If they had more than one COVID infection and recently tested positive again, and they are currently in the ED due to the complications from this recent infections. So yeah, you would enroll them, but again, the question should be directed to the first infection, not the one that they're. So there's a question on the survey that says like, have you ever been to the ED for the COVID infection? That question should be directed to the first infection, not the one that they're in the ED for right now. Does that make sense? And then should a participant be enrolled if they thought that they had COVID, but they never confirmed it with the test? So no. The person, like the patient has to confirm verbally that they had COVID and they saw a test that said they had COVID. And then should a participant be enrolled if they had multiple confirmed infections and all of the confirmed infections are more than a month ago? Yes. And then the question should be revolving around all those infections. So any infection that they had more than a month ago. Okay, so that's the screening part. Do you have any questions regarding the screening part? No? Okay. So then the survey. I feel just personally, the survey makes more sense if you do it directly on a red cap, just because there's so many branching because of the symptoms. So like if you go here, see if you get the paper survey, it might be a little confusing and you might miss some questions. So I advise you to do it directly on the red cap. It just makes things a little more easier, but I mean, you're free to do whatever works better for you. So I'm just gonna go through I'm just gonna pretend that I'm enrolling somebody. So have you had a positive COVID test? Yes, obviously, because they already confirmed it on the screening part, but this is just another survey, another question on the survey, just to reconfirm that. And then how many times? Let's say 7. If yes, how long did you have it the last time? Let's say, if they say less than a month, that should be a red flag because, oh, let's say that they said 1, right? And then they say less than a month ago. That's a red flag, right? Like they shouldn't be enrolled in the study, actually. Oh, sorry, no, I take it back. This is how long ago did you have it? Yeah.
I think that's about how long you had the symptoms, not how long ago you got.
Yeah, sorry.
Yeah, okay.
Okay, so let's say they say 1, and then 1 to 3 months it lasted. How did you confirm it? A home test. Did you ever come to the emergency department when you were sick with COVID? So this is that question that I was referring to, where let's say they had COVID last week and they're in the emergency department for that reason. So this question should be directed to their infection that they had the first time, not the recent infection. Does that make sense? Like, just maybe make sure that the patient knows that if they had two confirmed infections or more, and one of them was less than a month ago. I say
Yeah,
yes.
that question is confusing. That if yes, how long ago did you have it the last time? So how many times have you had COVID? So if they had it more than once, then it seems like this question is asking how
Yeah, I think
long
we need to
ago?
rephrase it.
Yeah, because we're looking for the most recent time that they had COVID, right?
Mhm.
Okay.
So I think I'm gonna rephrase that question.
Okay.
It should be, how long did you have it last time?
What was the duration of
Yeah, the duration of it.
your symptoms?
Yeah.
So how many times have you had COVID, and if yes, what was the duration? So
Of the last,
if they had COVID 3 times, we're looking for the duration. Because based on what we just went through, it seems like most of the questions should be directed toward the first time they had COVID,
mhm.
but this is the duration of the last time they had it, the most recent time.
Yeah, I think this is what it's asking, like what was the duration of the last time you had it?
Okay.
But now I'm wondering if it's actually something else, which is like,
Because I think if that's correct, then it seems like a clear way to say that was, if yes, what was the duration of the most recent time you had COVID?
yeah.
Yeah.
Let
Okay.
me ask Rob what he meant by this question, because you're right. It seems like it's saying like how long ago did you have the last infection, or what was the duration of your last infection? It could be like two options.
Yeah, it just should be clear.
Yeah, this should be clear. Okay, I'll ask Rob what he meant by this, and then I'll send an email out after.
Sounds great.
Okay. And then where did you have the COVID test? Okay, a home test. Did you ever have to come to the emergency department? Let's say yes. Did you ever have to stay in the hospital overnight? Again, this is for the infections that were more than a month ago. Say yes. Did you have any symptoms or problems that lasted longer than a month after you were sick with COVID? Let's say that they said no, then the survey is easy. You're just gonna ask the rest of the survey, which is mainly demographics. And they say possibly lasted longer than a month, or yes. Oh, this. Okay, sorry. No, and then I don't remember. So no, and I don't remember, you would just continue with the survey. Yes. Have you ever seen a doctor or healthcare provider or clinic or ER for any of these symptoms? I say yes. Where? A clinic. And then what were the symptoms? So they're talking about these symptoms. And then you click on whatever. You can click on multiple. And then here, this is where
We
so,
only fill out the ones that they said that they had, right?
yeah.
But there's not branching logic on it. Like all of them show up.
Yeah, all of them show up, and then you would click the ones that
That they
that
said
they mentioned. So if they mention fatigue, you would say like, how long did this last?
okay.
And let's say they lasted, I still have it right now. And then you go back here, chest pain. How long did it last? and then difficulty concentrating. How long did it last?
Okay.
And then you would continue. Are any of the symptoms that lasted longer than a month the reason you were here in the emergency department today? To say no or yes. Which ones? And then let's say that it's only shortness of breath or fatigue, sorry. Then you would click that. If they say all of the ones that I mentioned, then you would click all of them. Did you have to miss work or school because of the prolonged symptoms? So this one, actually this one, I'm going to change to radio buttons. I don't think we need the multiple answers because it kind of explains everything. Yes. And then you would write how long or unsure. Yeah, see, this should be a radio button. So I'll change that. And then have you ever had a COVID? So then this is where the survey, the demographic survey starts, and the questions that are not related to the long COVID. It's more, it's not related to the symptoms anymore. Like it wouldn't be a branching logic. And then have you ever had a COVID vaccine? Yes. How many? 1. When was your last COVID vaccine? Have you ever heard of long COVID? Okay, so this is another one. Have you ever heard of long COVID? Yes. Do you think you understand what it is? Yes. Then this right here, regardless of if they say they know, they think they know what it is, you should still let them know this, like what long COVID is. And then you would ask them, do you think you currently have long COVID? And I would say yes, no, or whatever. Then that's where the demographics start. Let me go back. Okay, so there's this question. So for no, and I don't remember, those questions won't pop up, but for this one, possibly lasted longer than a month. Okay, so which symptoms? Let's say they say cough and fatigue. Then you would do the same thing. And then the same thing. So the same process. You would go through it, and then it would, again, for the, it's the same process, basically. It's just the questions are directing more towards, they think that they have it, but they're not sure. And then these are just demographics. So how old are you, gender, are you Latino or origin or Hispanic, race, living situation, insurance, do you have a primary care doctor, language, and then complete. So the only thing that I'm going to change is the radio buttons for this. And then that question that Dana brought up, which I think thank you for asking that, because I actually agree. This doesn't make sense.
Is it possible to have, if you scroll down a little bit, right here, is it possible for this to be branching logic? Or is that too complicated to do?
Actually,
Yeah.
we did it. We
was a
did
mess.
it, but it was such a mess.
Okay. It just,
Um,
like, because if they have a whole bunch of symptoms, it would just be easier if, the ones they said they had popped up. But that's all right. We'll figure it out.
Yeah, Mireya, do you remember why we decided to do the table instead?
Yeah, because once you clicked one of the symptoms, it would branch out, but it wouldn't branch out in order. So by the time you hit the table, you would have all these bunch of symptoms, but they weren't specified. So you would have to guess, like, the first branching was a cough, the second branching was chest pain. But if you had like 6 branches, like, you can get confused whether the first branch was a cough and the second one was a chest pain. So we decided to do a table instead, so it could be more clear.
Got it.
Yeah.
Also, Dana, I remember too, when we do the data quality assurance, the extraction of the data, it's a mess if we don't do a table. Does that make sense?
Yeah, no, totally. It's totally fine. I just was
Yeah.
asking.
Yeah, I agree with you. Like, I think we all agree with you actually, that it would make more sense to